Right. And the proper alignment, as you have mentioned in another video, which has to do with your jaw bones and if normal teeth are out whack or for whatever reason, they could create major problem, headache, shoulder pain, neck pain, to migraines even, and a thing called TMJ to fix it. So if a dentist puts a implant in it slightly wrong, he would then manually create the same effect on your teeth otherwise being out wacko and creating all that, right?
Well, I would say not the implant per se, but if the implant's put in at a bad angle and it forces you to place the restoration not in an ideal location, that could throw the bite off and lead into the things that you're talking about. Exactly. The other thing too, people don't think from the engineering point of view. We want the implant to be in proper alignment with the jawbone and with the bite, because one thing that can cause premature failure of an implant would be the having the implant and the restoration not in proper alignment of forces. So lateral excessive forces because of improper placement of the implant and the restoration can potentially cause not only a TMJ problem, but it could also cause premature loss of the implant, and that would be a shame.
Why?
Especially now that we have the technology that essentially prevents you from doing that.
Well, since you mentioned this technology and this is obviously super important, let me ask you, how common is this technology amongst all the dentists out there? There is about 100,000 dentists in this country of the United States of America. Would you say everybody's operating on that already, or is that something relatively new? Fill me in.
Well, the adaptation of this X-ray machine for a private office is probably, I would say for the most part, within the last 10 years or so. The cost of the equipment is fairly high, so you're going to see this technology in offices that have multiple uses for it. Our office not only does implants, but we do TMJ work, we do sleep appliances, we do a variety of dental procedures that tend to be more medically oriented. So for our practice, having an X-ray that not only took pictures of the jaws and the teeth, but in more detail where we can look at things from a three-dimensional point of view, airway space, things like that, it was a no-brainer for us. So the average dentist doesn't yet own this technology. I would say probably over the next 10 years, you'll see more and more dentists. But there are companies that offer mobile X-ray technology where your dentist could either send you out to a local radiology center, or they can set up an appointment to have a mobile unit brought to their office where you could have it done there. Whether dentists are using it or not, it's hard for me to say.
Sure.
When Dr. Miles and I saw this technology, we were blown away by it, and it, again, because of the multiple uses that we have for it in our office, it was a no-brainer. You just pay it off over, over a number of years.
Sure.
You take advantage of the tax rules, I guess.
Right. So the technology is out there. It's a new technology. It has not totally caught on yet due to expenses mainly, but over the next few years will. So if a patient somehow...
Well, but it's based on older technology. It's just technology that you would normally find in a hospital, not in a private office.
I got it.
So this has been downsized and adapted for a dental office.
Beautiful. Beautiful. So basically you can now do a CAT scan of a tooth, get it all handled, basically. All right. Well, Dr. Melnick, thank you very much. Very informative, and it is definitely nice to know that the visit to a dentist is becoming, less painful, less daunting. Thank you very much.
Nice talking to you again, Helen.